Thanks. So as of 8 o'clock this morning, there are now a total of 60,386 cases reported in the world, of which 59,804 in China, a total of 1,357 deaths, of which 2 are outside of China, 507 cases in Asia and Oceania, primarily that's the cruise ship off of, and Japan. Middle East, 8 cases, Europe 46, United States 14, and Canada remains at 7, of which 3 are in Ontario, and the others are in BC. The lab data for, as of 8 o'clock this morning, 306 confirmed negative, 16 presumptive negative, 15 are currently under investigation, and we have 2 confirmed positive and another one that has resolved, another case that resolved, the one in London. So, as you know, the WHO has now named the novel coronavirus COVID-19, so that is the term we're using now. And just happy to say all our confirmed cases in Ontario at least are clinically recovered, although, as you know, 2 are still in isolation and awaiting having 2 negative specimens at least 24 hours apart to be released. The sharp increase in cases has come after Hubei authorities said they had introduced a new, quicker diagnostic method using computerized tomography scans, CT scans, or CAT scans, which health authorities said had diagnosed over 13,000 of the new infections. CAT scans reveal lung infections and are quicker than the RNA tests that are done on throat or nose nasopharyngeal swabs, which can take days to process in China. However, we're not really clear, as Dr. Williams alluded, on how to interpret this change, and there are a lot of questions to clarify the change in case definition, and I sit on the technical advisory committee of the Special Advisory Committee of the Federal Provincial Territorial Group, and that will be one of the technical questions we'll be looking at.
A couple of changes for the testing available in Ontario for COVID-19. The first one is that we've harmonized our testing at Public Health Ontario with the National Lab, and it's also the same test that's occurring at the BC CDC. That happened on Friday, and we ran specimens, all specimens in parallel at Public Health Ontario as well as the National Lab over the weekend, and they're concordant. And so that is a total of 81 individuals that were tested in parallel. 15 are still pending from the National Lab. But the effort is really to harmonize all of the testing to make sure that we are leading at the edge of the testing availability nationally and provincially. And that has been the strategy thus far. The other main update is that with this change, as of this past Monday, we are no longer sending negative specimens tested at the Public Health Ontario lab to the National Lab for concurrent testing. The rationale is that we've already done the duplicate testing to validate our testing that's available, and also it makes sure that testing results are available to clinicians and public health practitioners much more quickly. And so the turnaround time is now less than 24 hours, whereas we had a longer time in order to accommodate the duplicate testing at the National Lab. The positives, or the presumed positives that are tested at Public Health Ontario, would still be sent to the National Lab for concurrent testing for further workup and understanding of those results.
The new testing, Dr. Allen, I was wondering, this first couple that came back, what's the holdup if they're, like Dr. Yaffe said, they're not clinically ill anymore, they probably are fine. Why are the tests not showing them clear? Do they still have a viral load, or what's up with that?
Yeah, so there is some genetic material or viral material left in the individual specimens. We don't know what that means, whether that's live or dead virus, but I think the approach, and I'll defer to them, is we do know that there's some component of virus in those specimens, and the criteria that have been laid out are being followed, that we require 2 negative specimens until we understand more about what that means.
Does that tell you anything about the virus or raise any questions about the virus, given that the London woman is now clear and
Yeah.
kind of got sick like a day or two later than the first man? So
Yeah.
what does that tell us?
Do you want to take that?
Well, I think, and everybody's going to weigh in on different things. As you know, the first case was a younger person, and the history from material from China is that younger people tend to have a much shorter course and throw it off much quicker in there. And as you remember, she was originally negative, but on the more sophisticated test, it did show slightly positive. So on a precautionary basis, she was declared positive. It may not have been live virus at that time, but so that she might have been clearing already very quickly because of her more robust immune system, etc. The first cases were both over the age of older, and one had comorbidity, and one was our only hospitalized case in Canada, and had much more extensive pulmonary disease at that time. That's why the person was hospitalized. So what you're asking is, what's the clinical case course? This is very helpful for us to monitor these, to see how is it, because we don't have a lot of cases in Canada, especially one hospitalized. We only have one at the moment. I don't know if, Barb, you want to add anything on that?
Can I
or-
just break in though? You said that this first man had a comorbidity. So not being a science guy, I'm not sure. Now, I know what morbid means, it's not good, but what do you mean by comorbidity in his case?
We understand he had some other health conditions.
Oh, okay.
Yeah, whereas the London one was, as far as we know, was a healthy student and that kind of stuff. So we have to bring that into consideration. And you can see the data again from China, even with all the deaths mounting up. A lot of them are older and not young people, and they have a number of comorbidity conditions, especially cardiovascular and diabetes with cardiovascular complications. So this tends to, as I said before, much like with influenza, where they may not die just only of influenza, like a young person has nothing else. This tends to push those chronic conditions over the hill a bit, and they have consequences and sequelae due to that. So we're trying to get some better details, and I think WHO is going to try and do that on how's the actual case presentations, how they're coming forward, and how does it interplay with their other conditions. Why are we not seeing very young people dying suddenly in that, and they still haven't reported those cases, that kind of issue in China at all. So the clinical case is still new. We're still trying to understand it, and it's only informative, and following our case in Ontario might help at least us to inform ourselves, and as well as our federal authorities, on how it's going.